My name is Berna Berensen. I'm a physiotherapist at Great Western Hospital. You've recently been diagnosed with a stiff and painful shoulder. In this video, we will explain why shoulders go stiff and painful and how you can manage this condition.
A stiff shoulder is often referred to as a frozen shoulder or an adhesive capsulitis. It's a condition where the shoulder becomes painful and stiff, particularly into rotations, and when lifting the arm out to the side. It's thought that the stiffness and pain could be caused by the muscle guarding and tightening of the structures in and around the shoulder. Some people can link it to an injury, but often it starts without any apparent cause. It often occurs in people between the ages of 35 and 65 years of age. It's more common in people suffering other conditions such as diabetes, thyroid problems, and cardiovascular disease. Often the exact cause of the stiff shoulder is not known.
Osteoarthritis is another reason why the shoulder gets painful and stiff. Osteoarthritis of the shoulder joint is when the joint surface starts to show signs of wear and tear. This is more common in people over 60 years of age. Even moderate shoulder arthritis can cause chronic dull pain or intermittent flare-ups of intense pain that interrupt sleep.
The stiff shoulder is diagnosed from all the signs and symptoms that you tell us. Most patients will tell us that they are in extreme pain, especially at night, when they cannot get comfortable and the pain is severe. A physical examination will tell us how much shoulder mobility is lost. Most people will lose the ability to raise the arm out to the side and to reach behind their back or to reach behind their head. An X-ray can be done to check that if there are any arthritic changes in the bones of the shoulder.
In the beginning, the shoulder is extremely painful at rest and when moving the arm. The pain can be felt on the outside of the shoulder and the upper arm and can travel down to the elbow. Some people can feel it in towards their collar, the back of the shoulder. Sleep is often affected as lying on it is painful or even impossible. During this time of severe pain, we tend to tense our muscles and guard shoulder movement. During this time, the movements of the shoulder begin to reduce. Frozen shoulders get better over time. However, this is different for everybody. It can take up to a couple of months to up to 5 years, especially for those who suffer with diabetes. The passage of time is the main treatment for both frozen shoulders and the flare-up of osteoarthritis of the shoulder. Simple pain relief such as paracetamol and ibuprofen can be very effective to manage pain with stiff shoulders if taken regularly. You can obtain advice regarding medication from your local pharmacist or GP, but remember to read the packet and do not take over the recommended dose. Using a regular ice pack can really help with pain relief. You can have an ice pack wrapped up in a damp towel, place it on the skin of the shoulder and leave it there for 10 to 15 minutes. Make sure that you do not put the ice pack straight on the skin. Always have a covering between it. It's essential to exercise daily to maintain the movement and strength and function in your shoulder. Taking regular pain relief can help you to be able to do so. Do not continue the exercises if they are really increasing your pain, and seek advice from your physiotherapist or GP. Maintaining all normal activities, including work, improves your chances of recovery. This helps you keep your work fitness and prevents your shoulder from getting weak, which can prolong your pain. Remember, you do not have to be pain-free to return or remain at work. It may be necessary to do temporary lighter duties. This should be discussed with your employer.
The next section is a series of exercises that you can try at home. So now we're going to talk about the pulleys. So here you can see my colleague showing you how to safely put the pulley in your door at home. So make sure you've got an appropriate space to do this in. and you're just going to place the loop of the pulley within the door and shut the door tightly onto it. Once that is in position, you now need to make sure your pulley is the right height for you, depending on your arm length or your ability really in terms of your pain. So you can adjust this by tying a knot in the end of the rope, and this will shorten the pulley rope. So trial and error to begin with. Once you're happy with this, you're going to sit down and you're going to use your non-painful arm to pull the pulley down. This is going to lever your painful arm gently up towards the ceiling, just going within your pain limits. You're going to then lower down and gently alternate on each side. Try and do this for a couple of minutes until you feel a bit looser. If you find that this position is particularly difficult, then what you can do is turn to face the wall or the door that you've got the pulley in. That can make things a little bit easier for you. So start with facing the wall and then finish with sitting with your back against the wall. Shoulder shrugs exercises. Gently shrug your shoulders up towards your ears and down. Repeat a couple of times until your shoulders feel looser. Here's my colleague showing you how to do the pendulum exercise. You can use any of the variations shown as long as your pain is low. Doing this exercise for a couple of minutes can really help loosen any stiffness in your shoulder. Here you can see my colleague just gently rotating the wrist down and up again in a nice and controlled manner, holding a light weight. This can be really helpful for any rotation stiffness. Elevate your painful arm up towards the ceiling, using your other arm to support if needed. Try and hold still for a couple of seconds and lower down slowly. You can use no weight or you can use a small weight to strengthen your arm up further. This is a scarf stretch. Hold this stretch for between 20 and 30 counts and repeat a couple of times. This is really good for any tightness at the back of your shoulder. Place both hands onto a stable surface and walk your feet back slowly as shown. Hold the stretch and gently walk your feet back to starting position. Each time, gradually increase the amount that you walk back to stretch your arms further into a flexed position.
Thank you for watching this video. I hope you now feel that you are able to manage your stiff shoulder.